Hi, everyone. Thanks so much for joining us. I'm Stephanie Baker, Communications Director with Team Celeste. I'm joined here tonight by a whole bunch of people, and this is a topic of conversation that is on everybody's mind right now. We're here to talk about education and going back to school in the time of COVID-19. So I'm here tonight with Celeste Williams, a Democratic candidate for Congress and a nurse practitioner. Hi, Celeste. And I'm here with Representative Denise Garner from District 84. She is a retired nurse practitioner. And Representative Megan Godfrey from District 89. She is a former educator and also representing you guys right now. You can't see on the screen right now, but they will be joining us momentarily on the screen. I have Kyle Smith here, who is a current educator with Springdale Public Schools and a Fayetteville City Council member for Ward 4. And Micah Wallace, who is the Vice President for the Young Democrats of Arkansas. And they're here to provide us an educator perspective and a student perspective. So if you're joining us tonight and tuning in, please drop your questions in the comments. I anticipate we'll have a lot of viewer questions, so we'll get to as many as possible. We'll do our very best to address as many as we can. And if we don't get to your question during this broadcast, we'll be sure to go back through and answer to the best of our ability. So thanks everybody for joining us. Celeste, would you like to say hi to everyone?
So I would love to just say thank you all for joining us tonight. And I really appreciate you signing in to watch. And I'd like to acknowledge that not everybody has all the answers. And I think it is a time that we all have to have just a whole lot of grace in these conversations. And, you know, I think it's also okay to acknowledge that a lot of us are really scared about what the future looks like, scared for our children, scared for our, you know, in my case, my parents and people in the community that we care about, and feeling frustrated that things haven't been handled better. And so I think that every day is an opportunity to do better, and you know, we can have a conversation about where we need to go from here.
Thank you, Celeste. I'm going to go ahead and start with you, Celeste, for our first question. As a nurse practitioner, as a parent, what is your personal plan for your kids and going back to school this fall, and what concerns do you have?
So I will say that it is very hard to separate my thoughts as a parent from my view of things, leaning into scientific data and my professional career. You know, I would also like to say that what I do isn't necessarily exactly the best thing for somebody else. And we're all individuals that have to make the best decisions that we can with the data that we have to keep our families safe. So I will be sending my kids to school when they open. And, you know, there's a lot of good evidence out there that shows that kids under 12 are much less likely to pass on the virus, to get the virus. And, you know, even though intellectually there's a lot of fear about how things are going to go, when I lean into the data, I feel a little bit safer. And I might make a different decision if I had older kids or, you know, if I had children with health issues, but I don't. And I think it's also important to think about, you know, even if the school winds up being a blended year where it's part homeschool and part traditional education, you know, I'm living in a position where my husband and I work we alternate our work schedule. So there's always someone home to take care of the kids. And not everyone has that opportunity. And I really worry about the economic impact of someone who is maybe a single mom and doesn't have childcare available when she's trying to work and put food on the table and keep a roof over their head. And historically, a lot of times as parents, our favorite backup plan for childcare is grandparents. And because of the nature of this virus, that's not an option because it's oftentimes not safe for them. And I think that there's a tremendous amount of unknown. And I think that a lot of times it feels like the opinions are changing all the time, and they kind of are, because this is a new virus and there's going to be a lot of new information as time passes and a lot of different questions that can be answered through different scientific studies. So that was a really long answer to say I'm sending my kids to school when available.
Thank you for your answer. I'm going to now ask both Representative Garner and Representative Godfrey. As state legislators, I know that this is an issue that you guys have been grappling with a lot this week, and you're probably hearing a lot from your constituents. And I'm curious if you can share with us what you're hearing. What are your constituents concerned about? And what are you hearing in Little Rock? Denise, we'll start with you, and then Megan will let you respond.
Great. Thank you. And thank you for having me. Yeah, so obviously my background is in nursing. And so the powers that be put me on education committee. So I am on the education committee, trying to keep up with public health by going to those meetings and staying involved in the caucus. But I've learned a lot. I've grown up in an education family. My grandmothers, my mom and my dad, my sisters are all teachers. So I'm the only one in the family that's not a teacher. So it's not that I don't feel like I have some experience in education, but personally, I'm not an educator, at least not an educator in the traditional sense. So the thing that I have learned most of all as being a representative is that the most important thing is to listen to your constituents. And I don't have the answers, but many of them do. They've got a lot of great ideas. They've got multiple concerns. And so I've had several town halls with educators. I think that one of the things that's most difficult in the legislature is that we end up with lots of representation from administration and from the school boards, but we don't hear from the grassroots. We don't hear from the folks that are actually in the classrooms dealing with those laws and policies that the rest of us make. So I've spent a lot of time on town halls, virtual town halls, obviously. Spent a lot of time listening to educators across the state. Basically, we tried to stay in our district, and it just kind of ended up with a lot of folks from all over the state. But you know, the main question I think is, what does the first day even look like? I think that there are a lot of folks that are, because teachers don't come to work until a lot of teachers don't come to work until a week before the kids start. There just is not enough time to learn the new plan, to learn about COVID. Many of them have not been watching every day the governor like the representatives do, or the folks that are following very closely do. And so one of the big things is that we tend to ask teachers to take on all of the community problems. Every community problem is dropped off at the teacher's front door. And we're adding another layer of that with nursing and public health and sanitation and virtual. A lot of teaching them or asking them to learn a whole different way to teach. And so the thing that I heard most of all was not that they didn't want to be in school. I think everybody wants to be in the classroom. The teachers want to be in the classroom. The students want to be in the classroom. Everybody knows that's the best thing for kids and teachers and for learning. But what does that look like, and how much time are we going to have to make that happen? So I spent a lot of time talking to the Department of Ed, with Secretary Key and the folks working on some of the plans, some of the Ready for Learning plans, and basically have been asking for about the last month to at least delay the kids coming back so that we can spend some time with the educators, dropping some of that PD that they see every year over and over again, and change that PD to development kinds of courses that are more appropriate to what's going on right now. So the thing that I'm probably proudest of is that today the governor announced that the students will not be going back for at least 2 weeks, well, for 2 weeks. So that's not a whole lot of time, but at least it gives the educators some time to work with the new plans, to figure out how to deal with some virtual lesson plans, and to get some of those answers, some of those questions answered. In the education committee, we finally had an opportunity to ask questions of DESE. And one of the things that I came out of that meeting with is that we still had no answers. The local districts they have a lot of control. They have a lot of onus on them to make sure that everyone's safe. And so every district's going to be different. And so coming out of that meeting, especially in Northwest Arkansas where our cases are high, we kind of redoubled the effort to make sure that we had some more time. So I'm thankful that the governor did that today. So at least we have a little bit more time to deal with some of the questions that that the teachers have.
Thank you, Denise.
Thank you, Denise.
Megan, would you like to respond and tell us what, if anything, you're hearing from constituents in your area and what concerns that you may have?
Sure. Well, thank you again so much for the opportunity to be here. I feel like I'm wearing lots of different hats, but maybe most of all as a mother of a second grader, and we're having these same conversations and thoughts and questions about what's best for our family, what's best for our local school, our district, and our neighbors as well. And so I appreciate the opportunity to just kind of discuss and grapple with some of those issues while also looking for solutions. My district in Springdale has been hit particularly hard by COVID. And so I think it is especially important that as we're making decisions around how and if we go back to school, that we're listening to families who have been really impacted by COVID. I think we need to listen to the voices of those who are at most risk of contracting COVID or who have experienced the virus itself or even loss from the virus. And so I think it's something that I've been trying to be intentional about, is listening to all of the voices in our community, but especially those who really are very fearful, and for good reason, of the health implications of going back to school. What I hear is that, similar to my own decision making, is that it's a very, very hard decision. We, of course, want our children to be safe, and we want their teachers and every staff member who makes school work to be safe. But we also, what I continue to hear is how much schools matter, how much we appreciate school. I'm hearing from families, from all backgrounds, from all stories, who are saying, we love school. We want our kids to be in school because it is such an important place, not only because of the learning that parents are fearful they are not able to facilitate as well as a professional teacher. Parents are trusting the professionalism of teachers, but also because of so many of those other incredible opportunities that students have within a school. The opportunity to interact with their peers, interact with loving adults, to have healthy meals and time to play and move their bodies and have educational and extracurricular experiences. And all of those things are what make it really challenging to say, you know what, I think maybe we need to pass on school this year. I think parents, again, from all backgrounds, are saying, we love school, we trust teachers, we know that school is the best place our kids could be in an ideal scenario, but also it has to be safe. And so finding that balance between trusting school as the best place, but also knowing that it's safe. So what I'm hearing mostly, and what I'm deciding needing to help make my decision, is what are schools doing, what are districts doing to make school as safe as possible. I know that's at everyone's, at the forefront of everyone's mind, but particularly those communities that have been so deeply and intimately impacted by COVID. And they deserve to know, just like all of us do, that schools and everyone who works at schools is doing everything they can to make sure it's a safe place to be. Another thing that I've heard is that things are changing so rapidly, and the guidance is, there's still a lot of unknowns, and people don't really know where to turn to find the most current and accurate information. And so, like Representative Garner said, we had the opportunity to hear in the Education Committee, which I don't sit on, but I did attend this last week. We had the opportunity to hear at the state level what the Division of Elementary and Secondary Education's plans were, which in a nutshell really are to allow districts to have the flexibility to set their own policies. Which in some instances is a good thing. Different districts need different things. And even different schools within the same district may need different policies and different implementation. But at the same time, what I hear on the educator side of things is that both teachers and administrators are really desperate for strong and clear guidance. I think everybody is listening to the concerns of those parents and of those students who are worried and fearful about the public health and personal health concerns, and therefore would very much appreciate a very clear directive and plan in regards to all of those health considerations, such as mask wearing, social distancing, disinfecting, rearranging classrooms and common spaces so students are not as congregant. Thinking through all of those considerations is being done, is kind of put on the responsibility of the districts. And so what I would say, and what I've been doing personally as a mom and have been pointing constituents to as well, follow your local school district for the most updated guidance and their plans as they roll out. Get connected with their social media. Contact your school board member for your local school district, because it is going to be a decision that the local school districts are making, and that's going to be your best opportunity to stay updated with what each particular district's plans are.
Thank you, Megan. I appreciate that. There are several questions and concerns coming in the comments. We're going to get to those. I'm going to go ahead and let our other two guests come in for a moment. So we're going to keep Representative Godfrey and Representative Garner with us. They're going to be able to hear still, but we're going to see our other two guests for a moment. So I'm going to switch around our screens real quick. So here we have Kyle Smith, ta-da, there he is, and Micah Wallace. Thank you guys for joining us. Kyle Smith, like I mentioned before, is a Fayetteville City Council member and a current educator right now in the Springdale Public School System. Micah Wallace is a college student and the vice president of the Young Democrats of Arkansas. So they're here to talk to us from the perspective of a current educator and a current student. Kyle, we'll start with you, and then I'm going to mute everyone else because I hear a little bit of interference. Kyle, are you hearing anything from parents yet? Are they contacting you as an educator, as a city council member? What concerns are you hearing, both in your role as an educator and a city council person?
The concerns from parents that I hear are very similar to what our state representatives related. I think most parents go to them first because they understand sort of the power structure in this. The one other thing I would add that I'm hearing from parents is a lack of clear communication. We want clear leadership, but it is a complicated system, and folks don't always know where to look for that leadership. We've got our locally elected school boards. I know a lot of them feel like they are stuck waiting for state guidelines. And then we watch our daily press briefings and our state committee meetings with the Department of Ed, and we hear that they're leaving everything up to the districts. And both of those can't be true to the level that I think people feel like that's what they're being told. And so somewhere there's a middle ground, and I think it's just leaving a lot of people with a feeling of sort of unease.
So as an educator, what are your main concerns? Can you speak as a teacher to our viewers?
Yeah, and that's really where have been plugged in this summer is with groups of teachers they're talking about their experiences and their anxieties. And I think the biggest thing it comes down to for most of our teachers is uncertainty. A lot of it is just operational logistics. How do we handle lunch? How do we handle bathroom visits or managing our shared classroom supplies? Northwest Arkansas high schools have traveling teachers that share classrooms, so those classrooms are full of classes all day, every class period. How do we deal with kids in passing periods in the hallway when there may be thousands of kids mixing in one group multiple times a day? We've done all of the guidelines, but I think teachers look at them and have a hard time seeing how that fits with our regular everyday practice. There's also a lot of employment concerns. How will sick leave be handled? People are worried about their own personal risk, the risk of their families, and that they'll bring something home to a family member who may be more vulnerable. We keep seeing surveys go out to our parents about different options for virtual learning or blended instruction. And most of the teachers, we don't even know what blended instruction means to our district and our parents yet. So there's a lot of anxiety over what our workday is going to look like here in a few weeks. Are we going to be monitoring an online group and group of kids in the classroom at the same time? How do you do that? So a lot of the training that Denise talked about is, as much as we really probably don't want to beg for new and more training added onto the beginning of your PD, there's a lot of things out there that we know we need.
Sure. Thank you, Kyle. I'm going to ask Micah to share with us for a moment, but I'm sure Celeste has some questions for you guys as well. But I want to give Micah an opportunity to talk to our viewers about what are college students thinking? You are a U of A student, and I know we've talked earlier this week. I know you've been asking your friends, how do they feel? What are their concerns? And I saw already in the comments, a viewer has commented about he's feeling nervous about going back to school in the fall. He's a college student who has pre-existing health conditions, long-term health conditions, and he's nervous. What are you seeing? What are you hearing?
So first, I want to say thank you so much for having me here. I'm really very appreciative for this opportunity, and I want to echo the concerns that I'm nervous about going back in the fall. The U of A is scheduled to start back on August 24th, and the UAMS models that we have seen come out have not suggested that we will be in a better place by August or October even, and that is very, very worrying. As the U of A is the most well-funded and largest educational institution in the state, we can't expect to just not have any COVID cases. And so that leads me to wonder, as soon as we get our first COVID case, are schools just going to shut down again? Are students going to be kicked out of their dorms? And are they going to be expected to pay for the college experience that we expected, but is being stolen from us because of COVID? And it's really, really worrying to think of that. And so then on the other side, we have virtual learning, which takes away so many of the key experiences that makes college what college is. Whether it's social events or club meetings or networking, all of these things are so integral to a college experience, and we wouldn't be getting those. And then in addition, we have a possibility that international students will be deported if all of the higher education institutions switch to virtual learning. And so it just feels like there's no way to win here. My immunocompromised friends are so scared, and they absolutely don't want to advocate for only virtual learning, especially when they know that means that so many of their friends will be deported. And so this type of no-win scenario is something that we've been backed into a corner because we haven't taken the proper precautions to get rid of COVID when we needed to. There hasn't been a mandatory mask order. There hasn't been a lot of the simple things that we could have done to reduce the number of cases that we have right now. And it just feels so frustrating that at this point in college students' lives, our youth that we are never going to get back, COVID-19 is dictating how frustrating.
It's very frustrating. Thank you for sharing with us, Micah. I don't know if everybody's having trouble. It was breaking up a little bit for me. But yes, you're expressing frustrations that I know I've talked a lot about with everybody that is in this call right now. And Celeste, that's something you've talked a lot about how we should not be in this situation to begin with. And I wonder if you have anything to add when we're talking about educators and students, if you want to say anything to Kyle or Micah or have any more questions.
I do think, the entire point of us shutting down and sort of sheltering in place in the beginning was so that we could ramp up testing and contact tracing and be able to really do all that we can to mitigate the spread of COVID, which that didn't happen. We're still dealing with the exact same issues that we were in the beginning. We don't have enough contact tracers. We don't have the reagent for testing is a very short supply. I would certainly echo our governor's request for federal assistance in the procurement of that so that we make sure that we can continue testing, because we cannot ramp up testing, which is exactly what we need to be doing right now, if we don't have the supplies that we need. And certainly, teachers are, they are being treated as essential workers, and all workers should be able to have the safest work environment possible. And we need to make sure that we are using federal funds to help make sure that there is enough PPE in the schools, that we are not burdening our already thinly stretched budgets to get all the needed things to modify classrooms to make it safe for students to attend school. And I don't hear anyone talking about that in state budgets or local school budgets, and that's something that the federal government needs to address.
Thank you, Celeste. Another thing, while we have Kyle here with us, there was a question that came in about school buses. How do we physically distance kids and prevent them from breathing the same air on a school bus? Is that anything you've heard from your school district? Is there a plan for kids riding buses to schools?
I have not seen that plan directly from the district where I work. I've seen commentary on it from the Fayetteville district. I think there needs to be some really clear guidelines that are based in the science and can tell us what's safe, or at least safer, so that it's not left to the decision making of people who yell loudest. I mean, it needs to be something that comes from a place of public health, because lives are at stake in this. Whether it's school buses, classrooms, anything, all of those policies need to come from a place of data.
Yeah. I'm seeing so many comments come in from viewers wanting more virtual options, or an option for every student to have virtual learning, so that there's more spacing and less staffing needs and less kids in the classroom. As a teacher, how do you prepare for that? And then Mike, I'm going to ask you to speak to the student perspective. Like, how do you feel about virtual learning as a student? Because I'm sure you got to experience a bit of that this past spring. Kyle, I'll start with you. How difficult is it to transition your learning plan and your teaching style to a virtual program? And how do your students respond?
Well, I think, Micah hit the nail on the head earlier when she was talking about that college experience, and it's the same for kids in a classroom. When you go virtual and you lose that face-to-face interaction, even if it's through a computer screen, it is just not the same. And there are people who make online education work great for them. It's not for every kid, and it's not for every teacher. And that's one of the things we're gonna run into is it's a major paradigm shift for a teacher who may have been in the classroom for 25, 30 years to suddenly have to work through a box instead of through their hands and their heart and their soul. And that's really what makes me most nervous about the reliance on online learning, is that it is not a panacea that's going to fix everybody's problems. It has some benefits, but we saw in March what happens when you make a rushed switch to it. And that was out of necessity. I'm not going to blame anybody for the way that went. But we have time to prepare, and I'm glad the governor gave us an extra 11 or so days so that maybe we can have a chance to come together as professionals and really talk through what that shift will look like when it happens again. And I say when, because it's not an if. The way our numbers are going, we know that we're going to reach a point where it is unsafe to be in our schools with the size populations we have. We have to be ready for that when it comes.
Yeah. Micah, would you like to speak to that again? I know you touched on that when you were talking about losing the experience of the social experience of being a college student, but I really want to hear from you from a learning perspective. How was it shifting from in-person classes to all virtual learning?
Virtual learning is a absolutely valid and safe way that we could transition into a non-person-to-person contact style of educating people. But at the same time, we can't deny that we enrolled in college for these in-person classes. And so many students are feeling that way, that we signed up for one thing and now we are getting a different thing. And I think the largest point to be made when we talk about transitioning to virtual learning in college is that there is no way that these institutions of higher learning can justify keeping tuition the same if we are not going to be going to in-person classes. And while I completely empathize with teachers and feel absolutely horrible that they're changing what could have been years of lesson plans or years of work, being forced to accommodate this new situation, it absolutely makes no sense that students are being forced to pay the same rate for an education that is not what they signed up for. And I think that that is a critical piece that we have to understand, is that even though we are going back to school on August 24th, according to the U of A, we are still probably going to transition to being online just because of COVID cases rising, and not adjusting the tuition for that is just a slap in the face to college students.
Thank you, Micah. I'm going to go ahead and transition back to Representatives Garner and Godfrey. But before Micah goes, she has a special message for a viewer. Go ahead, Micah.
I just want to say thank you so much for allowing Young Democrats of Arkansas to be a part of this, and happy birthday to our WIDAR President, Blake Ross. We are so lucky to have you leading this organization.
Thank you, Micah, and thank you, Kyle. Thank you. And Micah and Kyle are still going to be monitoring comments, so if you have specific questions for them, please feel free to ask in the comments and they will do their best to reply to you as well. I'm sure you guys have lots of questions that may be specific to an educator, to a city council person, to a college student. So I want you guys to have that opportunity if you have questions for them. And now I'm going to add back, I'm shuffling all these videos. It's so fun. Okay, I'm going to hide myself and let these three wonderfully intelligent ladies take this conversation. Celeste, I'm seeing a lot of comments about the grandparent discussion. You mentioned that for a lot of parents, grandparents are who you have babysit, and that's not really an option right now with COVID. And I'm seeing a lot of people talk about, well, there are grandparents who work in the schools. There are people who are of that same age range, who are teachers, who are administrators, who are custodial staff. How do we protect those folks in our schools? And do you have an answer about that from that perspective in your healthcare role?
That is a complicated question, and there's a lot of nuance to it. Certainly in elementary schools, there is less risk of those children passing the virus on and getting it themselves. So that is what the science is telling us. That's certainly earlier stages. And so anybody who's read research articles knows every research article says there needs to be more data. And so, but that gives me a little bit more comfort. That doesn't answer what to do in other school situations. And so part of that is making sure that we are doing things in the safest way possible, which would be wearing a mask, good hand sanitizing, and watching our distance. And so there are some options of cohorting classrooms and that type of thing. And rather than get too much farther into the science of it, since I'm also running for Congress, we need to make sure that we are actually tackling the problem at its root, which is COVID. And again, that is making sure that we are testing, tracing, and doing all that we can to mitigate the spread of this virus so that we can get back to our normal lives, whatever normal is going to look like on the other side of this, as soon as we can. It is absolutely highlighting the inequities in our communities. And children are missing out on some really important growth and development that they get at school. And certainly COVID has highlighted some of the problems in areas where there are more rural places that do not have access to broadband, so that if they wanted to choose a blended school year, they cannot. And if we're forced to go to that, then again, you're in a place where you can't provide an equitable education. And I think the most important thing to do is actually come up with a federal plan to tackle the coronavirus.
I'm also seeing several comments here about PPE for our teachers. And that's something we've talked a lot about as a campaign, is that, we have essential workers during this pandemic, and they should be given proper protections while they're working. And we all agree that teachers are essential workers. What is being done to ensure that our teaching staff have the supplies that they need? Because we've all heard the stories about teachers having to buy dry erase markers on their own and their own classroom supplies. What are we doing to make sure that they have the masks that they need, the hand sanitizer that they need? And I'm going to we'll start with Megan and Denise, whichever one of you wants to address that first at the state level. I know that they moved the start of the school to August 24th. What if we still don't have enough or a plan at that point? Denise, Megan, who wants to start?
I'm happy to speak a little bit to what I know about districts in my area. I do know that PPE for teachers and for all school personnel is a priority. And is a financial, but also a health priority for both Springdale schools and Fayetteville schools. In my time working on the team for Fayetteville schools, there were a lot of conversations about not just face masks for teachers, but also teachers who provide dyslexia services and ESL instruction, the need for kids to be able to see their mouths and just how important a student being able to visualize the teacher's mouth is. And so I know that there was a conversation early on about providing face shields for certain individuals who really need to use their facial features and their mouths to be able to instruct. And then kind of thinking more broadly about how we can really think about the professional responsibilities of teachers, but also the health needs as we do make decisions about PPE. I know for Springdale that they are providing face coverings for all teachers. And I think I read somewhere, this may not be correct, but I think I read that a face covering will be provided for all students as well. And so as far as particular districts, looking at just the importance of PPE as far as face coverings goes, the districts are investing in providing those both for students and teachers. As far as disinfectant goes and other kind of non-contact opportunities or ways to reduce that spread, I know that Springdale is putting in water bottle holders and has encouraged or put on the school supply list that students should bring their own water bottle to fill those up instead of being at the water fountains. I know that the custodial staff is going to be working very diligently. Shout out to all school custodians for as hard as they work already, but then the extra responsibility of doing extra contact cleaning, extra disinfecting, and making sure that those surfaces that students are touching and that teachers are interacting with are as safe and as clean as ever. So I do just want to give a shout out to the schools and districts who are making adjustments, being intentional, thinking through not just PPE, but other cleanliness and disinfecting measures. And also know that that's something that families are most concerned about. Again, back to the idea of wanting kids to go to school, but wanting to be safe. I think that everybody wants to know what that concrete plan is to ensure that the spread is as limited as it can be.
Thank you, Megan. Denise, I'm going to let you address that also, the PPE question, but also since you are on the education committee, there was another question about substitute teachers and the policy around that. So I wanted to go ahead and ask you that as well, if you could address that, if you know that if there's been a policy proposed about that.
Absolutely. And let me just say this, and it's one of the reasons that I'm here for Celeste. The biggest issue is one that was mentioned early on, and that is the lack of leadership, both in the federal level and I think even in the state level. We would not be in this situation if we had learned the lessons from the folks that came before us, and that we had a federal leader and federal leadership in our state to take on the responsibility for some of the issues that we're dealing with now, like procurement of some of these kinds of things, like PPE, like testing supplies, those kinds of things. And I think there's a place for everybody. The federal government should never have sent the states to all of those kinds of things. The National Defense Act should have been started a long time ago. Celeste understands that. It should be now enacted to take care of testing medium and those PPE, the things that we can't get, the testing machines, the reagents, the swabs, all of those kinds of things that are now scarce in these places like Northwest Arkansas. And so there's not been the leadership to take on the operational kinds of issues, and there hasn't been the leadership to show the way in making sure that we are using the data, that we are doing the things that that scientists across the board are telling us to do, like wearing masks. And so we need that leadership, and that would have made all the difference. I think we have, I think the state has done a fairly good job, especially early on, in trying to do the right thing. They're just way behind in doing it. And so that's one of the things I've been trying to do with the governor, is try to make sure that they understand that what we do today does not affect what happens in the COVID issues until 2 weeks or 3 weeks later. And so we're stuck for the next 2 to 3 weeks. We have already, that ship has sailed. We know there's nothing we can do to make sure that the next 3 weeks are better. But there is something that we can do to make sure that after that is better, which is why we tried to make sure that we had that extra at least 2 weeks. And my guess is we may see in several districts that we need more time than that. But all of these things that we're talking about, the PPE, the face shields, the testing, all the things that we need to go back to school, it would not have been an issue if we had had good federal leadership. Then the state could have coordinated that effort and made sure that those things that we need were dispersed the way they should have been. Unfortunately, I think the state has kind of given the onus to all the responsibility and the onus to the local school districts. And without that leadership, without that guidance to make good decisions. And so we're still dealing with the fact that I think Governor Hutchinson is trying to kind of stay in the middle, but in doing that, and I understand it is tough to balance the economy and health. It is tough to do that. But until we get the health crisis situated, there's nothing we can do to fix the economy. Absolutely nothing. And will we lose some time in education? Maybe. Will we lose some efforts in our economy? Yes. But those things will come back. We can make those things happen over time. We cannot bring back the percentage of folks who will die because of this disease. And we've got to make sure that that happens. So I think that a lot of these questions are so reliant on what your district is doing. I happen to have Fayetteville and Springdale, which are both large districts, and then Elkins and Greenland and West Fork and Prairie Grove, which are much smaller. And so now that we have a little bit of guidance, which is what we asked for in the committee, Megan and a lot of my colleagues were asking the questions that these teachers have asked, and they need a little bit, and the districts need a little bit of guidance anyway. We've got to have, you can't just give the CDC information out to a group of teachers or a group of administrators to a district and think that they're going to understand what exactly they need to be doing. I have to say that it's so important that we're all working together. It's so important that we spend time with our federal leadership, our state leadership, our city leadership. I have to give a shout out to Fayetteville. Fayetteville has been progressive from day one to make sure that we are out front and doing the things we need to do at the time we need to do it. We have just made sure, thank you, Kyle, as you're still listening, thanks to the city council. We've just reappointed a medical health board, health advisory board. And so now we have some folks that the district can go to. We have folks that the university can go to. We're talking about adding 25,000 more people to our population in the next 3 weeks with the university, and half of those are coming from Texas, one of the largest hotspots. So we've got to be able to work with the university. We've got to be able to work with the school districts. We've got to be able to work with everyone in our community. And it's going to take all of us. It's going to take all of us working together. And one of the things that we need most is that federal leadership that we just do not have in Arkansas right now. And so thank you, Celeste, for running. And we've got to make those changes because it's something that, if we have a stopgap in the middle of the chain, a weak link in the middle of the chain, then we can't do what we need to do down the line. So that didn't answer the questions about PPE. It's a national problem. PPE is a national problem. The reagents are a national problem. And until we get some federal leadership in making those things more available, then we have to do what we can do. And that is make sure that we, if we don't have those things that are going to determine health for the educators, for the bus drivers who do have a high average age. Many of our bus drivers are retired. A lot of our teachers are over 65. We've got a lot of folks, the lunch ladies, everybody in the system. We've got to worry about their health and safety. One of the things that Celeste has talked about is the that the new research is showing that children are not as susceptible and not as contagious. But the reason that is basically because a protein that children have is not developed enough to connect with the COVID virus. So what happens is that we don't know when that changes. Is that in 5th grade? Is that in 7th grade? Is that in high school? So yes, elementary, kindergarten, we may be a little bit safer there, but we really don't have enough information to know about the infection rate for those students that are in middle school, junior high, and high school.
Thank you, Denise. And that brings me to another point that I'm seeing a lot of people discuss, that when we're talking about education, don't leave out those older students. And you know, Kyle, who's with us tonight, is a high school teacher. When we're talking about going back to school, we're not just talking about elementary school age children. We're talking about our middle school, our junior high, our high school students, our college students, and all of our staff and educators, custodial staff, bus drivers, everybody, as Megan so eloquently put, who makes our schools work. I liked that when she said that. That was lovely. So there's a lot of things to be concerned about. Yeah, Kyle wants to add something. Kyle, let me put you back in the stream. Hold on one second.
No problem.
Go ahead, Kyle, you're on.
I'm really glad that we've got people from all levels of government here, because as Denise was talking about, it really takes all levels of response. But here on the local level, you know, we usually look at the university and think, oh, we're going to have those 25,000 students come back. And somebody from our Board of Health said the other day, if we can't get Dixon Street under control, it won't matter what we do on campus. And I think that that's an indicator of just how interwoven all of these different layers are. A state institution sitting here in our local community, students don't stay on that campus. But we tend to overlook the public schools as far as their risk to the outside community. And we talk a lot about teachers and students and staff and their families. But as a council member, I worry about our whole community, and no workplace, no service, no institution in Northwest Arkansas draws as diverse a clientele as our public schools do. You know, we bring together this cross section of all parts of society and every subpopulation. We mix them all together. We share experiences with one another, and that's great. That's what makes public schools such an amazingly strong asset. But you know, when you've got a contagious health crisis, it's also vulnerability, because then we send those kids back home to the entire community the same way. And when we passed our face mask ordinance, you know, I got a lot of phone calls saying, "Why are we doing this in Fayetteville? It's really just immigrant workers in Springdale that are getting this at work." And that was a piece of feedback that I got over and over and over. And I had to remind folks that, you know, look, I'm going to go back to a classroom where those workers' kids are going to be with your kids, and nobody's going to be safe from this. And that's why I'm glad that we've got, you know, Celeste here looking at it from a federal level, because we don't have the resources locally to solve it by ourselves. And it's going to take folks from all levels. And that's just something that I'm afraid that we sometimes forget, is that we get so locked into the education goal that we forget that, you know, we can't educate a community that's not alive and healthy.
Absolutely. Celeste, I want to come back to you and talk about, what do we need from our federal government right now? If you were our congresswoman, as you will be soon, what would you be doing differently than what we're seeing, what we're not seeing Womack do right now, what he's not demanding of our administration? Oh, hold on. I think you're muted. Let me unmute you. There are so many people on the stream. You're good. Go.
So right now, we need to have federal funding for PPE. We need to have federal funding for testing supplies. And if we need to, we may need to use the Defense Production Act to make those things, because they're not readily available. And right now, what we have is hospitals, clinics, state facilities all trying to get the same supplies, and they're bidding against one another, which obviously drives up the cost. And that is ridiculous that is what we're being forced to do, that states are bidding against one another to procure these needed supplies. In addition, we need to make sure that we are properly funding our public education system in order to have teachers get additional education and training if needed for doing online teaching, if that's what we need to do. And then we also need to make sure that we are paying for the physical modification of classrooms that will be needed to keep our students safe. And number one, we have to get this virus under control, or nothing else matters. Like, we have to do that. And there is not a big national plan or strategy to do that right now. There's a complete lack of will to actually address this virus and do anything to help mitigate the spread from a federal level.
So because the federal government isn't advocating for us, it's leaving our state to make very difficult choices that none of us want to make. There is no perfect answer, as all of you have expressed to us tonight. We are getting close to the 8 o'clock mark, which is when I told you all I would let you go. So we have so many questions that are coming in. I'm going to ask one final question that I think is a fairly important point that one viewer mentioned, and then I want to let all of you have an opportunity to give your closing thoughts to everyone tonight. And again, if you're watching and you had a question that we didn't address, we will go back through these comments over the next day or so and get back to you as best we can. But we heard in the press conference, we've heard you guys say that, you know, we're going to go back to school in some capacity until we're forced into a virtual situation. We've heard that language, forced into a virtual situation. The question from our viewer is, what forces us into that situation? Is it a teacher getting sick, a student getting sick? Is it somebody dying? And why do we have to wait for that? We already know that we're going to have more of a spike possibly in the fall with flu season coming. The viewer's question is, why are we risking that? Why aren't we just doing all virtual, taking the fall off to get this under control while our cases are still peaking? Who would like to address that question?
I'll take it. I'll just say that we have to have guidelines in place for what the community looks like before we start school. If you have a peak in cases in your community, then obviously it is not safe to go back to school. And I hear and I see that we are really not in a place in Benton and Washington County right now where it feels very safe to go back to school.
Denise, Megan, Kyle, do any of you have anything to add to that? Denise, go ahead.
And that's
Denise
where that
is
leadership
muted.
comes in. That's something that, am I unmuted? Sorry.
Yeah, you're unmuted.
That's one of those things that I think is really a leadership fail. We should have that information. I think most epidemiologists feel that, if you have over a 2 or 3% positivity rate, you shouldn't be going back to school. If you don't have 5 contact tracer per new case, for every new case, that means 800 times 5, we need contact tracers, and we don't have anywhere close to that, then you shouldn't be going back to school. Obviously, not everybody in Arkansas is dealing with those kinds of things, but Northwest Arkansas is, and Central Arkansas is. And so what I'm hoping to get the governor to think about is to have a little bit more local control. If we get 25,000 students back into Northwest Arkansas, half of those from Texas, then it may be that we need those bars shut down. We need to make sure that city ordinances are taken care of. We need those kinds of local control issues. And I just think that we've got to have some of those kinds of things in place in those areas where the virus not spiking. This is still the first wave. We are not in a second wave. This is still the first wave that we didn't stop the first time. And I think there are a lot of reasons that the state is looking at economy and health and trying to balance those two. But if we had some help at the federal level and we could make sure that the folks had what they needed to actually stay at home and do the things we need to do to get rid of the virus, it would have taken much shorter time than it's going to take now, as we're trying to just take care of these spikes all over the country. So leadership does matter. Your vote does matter. It matters who we have in Washington, in Fayetteville, Arkansas, in Springdale, Arkansas, in Elkins, Arkansas. Everybody pays attention to not only what's happening in your local district, and those district COVID teams need to have educators, they need to have community members, they need to have parents, they need to have all of the stakeholders on those committees, and not only look at the very, very local level, but pay attention to what's going on in Washington, that know what's going on, that care that their voices are heard in DC. And that's important at the city level. It's important at the university level. Thank you, Micah, for your leadership there. It's important at the state level. And I can't tell you how excited I am to have colleagues like Megan Godfrey to help with these issues in the state level. And we need folks that will listen and learn, research, assess, plan, do that all over again when needed, and make sure that our voices are heard in Washington, D.C. So thank you, Celeste, for running. And I'm glad. I know the rest of us are glad to answer any questions that we can from Facebook or from cell phones or from emails. So if there's something that we didn't get to, feel free to give me a call.
Thank you, Denise. I want to acknowledge I'm seeing a lot of frustration in the comments, and I'm seeing some folks saying there are more questions than answers and not a lot of solutions being presented. And that is something that all of you have acknowledged. And we're here tonight having this conversation because we wanted to hear your concerns and we wanted to hear from you. We none of us are pretending to have all of the answers, and that's part of having this conversation, is because this is an unprecedented situation that we're all trying to navigate. So I just want to let you know, viewers, that we all hear you, and we are all, as parents, as educators, as representatives, we're all equally frustrated and trying to navigate this. And I'm sorry that it's a frustrating situation. Megan, do you have any closing thoughts for us tonight?
Sure. I would just want to, reiterate the uncertainty that so many of us do feel, the frustration, and really the questions that we do all still have, just like you mentioned. The Department of Education has called their plan Ready for Learning, but I don't know that many of us feel completely ready. And so I do just want to acknowledge that there is still so much to decide and to be determined. I also, there was a comment about just the importance of mental health for students as they return, and even for staff members as well. And so with that, I just want to acknowledge that as teachers go back, ready for learning or not, ready for teaching or not, the amount of work that you're asked to do, first of all, is unfair, but second of all, is so, so appreciated. As a representative, as a mother of a student, and as someone who has been a classroom teacher herself, I know that what you do is, no one knows how much classroom teachers do. And now having to add new classroom protocols for, how we wear masks in our classroom, and when we use hand sanitizer, and how we store our supplies instead of in collective bins, we have them, in individual pencil boxes, all of those things that you're having to think through, as well as what does remote learning look like in a context that I've never taught outside of my classroom? And what does it look like if I'm having students come back into my classroom who've had a really hard 5 months? What does it look like for me to consider the social emotional needs of my students while, very purposefully integrating rigorous content because of that lost learning that we experienced for 5 months while we were not on site? And so I just want to acknowledge how difficult and unfair your task is, but as somebody who really understands what all you're having to do without all of the answers and without all of the necessary materials or funding or supplies, please know how grateful I personally am, and that so many of us in the community are. You are essential, and we are so glad, and families all across our district and all across Arkansas are saying thank you for everything you do, even if it's things that you shouldn't have to do. So thank you so much, teachers.
Thank you, Megan. Kyle, do you have any closing thoughts for our viewers tonight?
Yeah, teachers want to be in school, and we want our kids to be in school. There's a reason we chose this profession. It's because we love the work we do, but we don't want it at any cost, especially if that cost is people's health and their lives. And so we've got to get this right. But I hope that we can look at this as potentially a learning experience. There's an opportunity here, in addition to figuring out new ways to manage our supplies and our lunch periods. There's also an opportunity here to grow our skills as online teachers, and for students to grow broaden their horizon as online learners. It doesn't have to all be scary. Megan talked about the loss of learning, and we hear a lot about that from the State Department. And let's not pretend that our preconceived notions of annual growth have been serving us all that well anyway. That maybe this is an opportunity for us to learn new assessment techniques and do a better job of addressing kids where they are. They're not computers with a progress bar that tells us how much information has been downloaded. We've got to get in and get to know kids. And they're going to come back to us, some with extra learning loss, some that have had great involved parents at home that have helped them stay up to date and maybe even get ahead in all this. When our kids come back, they're not where we left them, and we've got to figure that out and meet them where they are. And this is not going to be just a one semester problem that we recover from last spring. We're going to have parents that are taking their kids to homeschool for the next year, or keeping them at home for virtual learning through our schools. That's not going to work for everybody. Some of them may want to move back and forth between campuses over the next couple of years. This is a skill that teachers are going to have to hone for this entire generation of kids if we're going to adequately serve their education needs. So we have to be willing to grow and maybe look at this as an opportunity to leave education better than we found it. To do that, we're going to need really strong advocates at the state and federal level, because we can't change our own accountability metrics without their help. So
Thank
I
you,
really
Kyle.
hope that we can look at this as an opportunity.
Thank you, Kyle. I appreciate you. Thank you very much to all of our guests for joining us tonight. I want to remind all of our viewers that if we did not get to your question, we will go back through and read through all of these comments and do our very best to respond. If you have a concern that you want to address specifically to Representative Garner or Representative Godfrey, I'll put their official email addresses in the comments after we wrap up tonight, so that you can send them an email if you have if you're a constituent and have a specific concern. There's also a link currently in the comments to a survey that the Celeste campaign has put out, just to get some of your feedback about how you're feeling about going back to school. And there's even a blank text box where you can tell us whatever it is you're thinking. And we want to hear from you. We want to know what you think. Oh, and it looks like Megan has one more thing to say. Let me unmute you. Go for it.
Sure. I wanted to say, si necesita información en español, muchos de los distritos escolares tienen información en español, o si tiene alguna pregunta de las escuelas, en español me puede contactar si necesita. Also want to give a huge shout out to all of our bilingual or non-English speaking parents who are trying to do AMI at home with their kids. just completely crushed it, reaching out to teachers, asking for help, doing everything they could do with just with such an unimaginable challenge. Just wanted to say thank you to all of our parents who are non-native English speakers who were facilitating learning at home. So
thank you, Megan. I appreciate that. Thank you. So again, there's a survey link in the comments. I will also put links on how to contact Representative Garner and Representative Godfrey. I'll put links to their websites as well. And I'm going to let Celeste close us out this evening. And again, I'm grateful for everybody joining us. Thank you all. Go ahead, Celeste.
I'll just echo some of what Kyle said. I absolutely agree that within every great problem, there is an opportunity. And I think that that is absolutely right, that we have a chance to reimagine not only what our education system looks like on the other side of COVID, but also what does healthcare look like? What does our economy look like? What opportunities are we creating for people that live in this country so that we can work diligently toward a more just and equitable society so that each and every person who lives in this country has an opportunity to attain the American dream. And I think it's really important to hold on to those moments of hope when we're looking out at the world right now and just absolutely shocked that here in the United States of America, we are absolutely failing our citizens in our response to this disease. And even though we cannot go back in time and undo the way things are handled, we have today and we have tomorrow. And we absolutely can start making changes right now. And I know that sometimes as an individual, it feels really like a place of no power and no say to make a difference. And you can. You can wash your hands, wear a mask, and watch your distance. And I know that everybody is probably sick to death of hearing that. But that is the only way that we're going to get through this, is all of us doing those things together so that we can get through this and get on to whatever is going to be the new normal. So I appreciate you all. Thank you for the questions that you've asked, and I look forward to seeing you at the next town hall.
Thank you.